Waiting your turn. I remember how many times. Sure, we got a minute.
Can you hear me? Las Vegas, can you hear us?
Yes.
Lynn, do you hear us? All right, we can see you, but we cannot hear you, and I can't tell if you're answering to us or having a conversation with somebody else.
Can you hear us now?
Yeah.
Well, the NSA can hear us, so that's okay.
All right.
I can't see. Where am I missing where they are?
They're face backwards. You're looking at the audience, right?
Oh, so we're viewing the audience, so we cannot see anybody on the board.
Correct.
Hi, CJ. You have quite a crowd.
Are you hearing us?
We do.
You have many more people than we do. There we go.
All right. Now I think we're ready to go. All right, we're running a few minutes late, and I apologize for that, but we finally got connectivity. So with that, I'm going to call the meeting to order today. And for those of us that are here in Carson City, it looks like we have new equipment. So if you're going to speak, please push the push button and watch for a little green light to turn on. And when you're done speaking, if you'll turn it off so that we don't get that overload on audio. I don't think I have, for those of us joining us on the phone, we would ask you to put your phone on mute. And then also, please do not put us on hold so that we get that wonderful elevator music when you do that. So with that, I think I'm done with any announcements. Mr. Roos, do you have anything that we need to add?
I don't.
Okay, then let's have the roll call.
Okay. Ms. Johnstone? Here. Ms. Lewis?
Here.
Dr. Klein?
Here.
Ms. Kerr?
Here.
Dr. Ford?
Here.
Mr. Wilden?
Here.
Commissioner Kipper has indicated that he will not be here today. Director Molenkamp?
Here.
Vice Chair Atkins?
Here.
And Chair Campbell?
Here.
We have a quorum.
Thank you very much. That brings us to public comment. Do we have any public comment there in Las Vegas?
Yes, it looks like we do.
All right, if you'll identify yourself for the record, and public comment has been noticed to be no more than 3 minutes, and we would hope that you would respect that. We have a big agenda today.
Good morning. For the record, my name is Barry Gold. I'm the Director of Government Relations for AARP Nevada, and I am so thankful to be saying that outside of the legislative building. So I said that way too many times there. The reason why I'm here is normally I wait till the end, but I have some documents that I want to give to the board members of the exchange. I know I've sent a few, and I've sent an electronic copy to John Hager this morning, as well as the issue brief that describes it. It's the State Health Insurance Exchange websites, and it's discussion and recommendations about consumer information about quality and performance. I know I've given some to some of the board members before. I can also have this electronically. There's a lot of good research that AARP has done on a lot of things about websites and providing information. I have hard copies for all the board members that I can distribute as you like. I can send them all up north to Carson City or leave them with the board members here, as well as sending electronic copies. I just wanted to make that information available. Thank you very much.
Thank you.
Thank you. We appreciate that, Mr. Gold. Is there anyone else?
And we
there?
have one more person.
Okay, thank you.
Good afternoon. For the record, I am Patty McCoy with Nevada Health Co-op. and coming before you to discuss also quality ratings and the agenda item that's up in front of the board regarding accreditation and star ratings. Nevada Health Co-op, as many of you may know, is a new entity coming forth in the state. We are seeking NCQA accreditation with a survey date of July 9th for interim accreditation. Since we don't have any members, we don't have any star ratings. And so the proposal before the board to potentially have star ratings and quality ratings may lead to an unfair advantage in some respects in showing that some existing plans that aren't even exchange products may have some better products out there than us. And we have new products coming on, so we haven't had the ability to have ours accredited or have members, as I said, to evaluate and through the star ratings. So we are advocating that accreditation be on the website. So just in the list of accredited or non-accredited, and that the star ratings be added at a later date. Thank you.
Thank you. I think that's it for down south.
All right, thank you. Do we have anyone here in Carson City? Looks like none. Do we have any on the telephone? Doesn't sound like we do. So we'll close this agenda item and then just know we have public comment again at the end of the agenda. Next item on the agenda is the approval of the minutes from May 9th, May 16th, and May 29th. Do we have any additions, edits, or amendments from board members on those minutes?
Madam Chair?
Yes.
Lynn Atkins for the record. So I just have a question on the January minutes. I think
January or?
ones. I'm sorry. The May ones. Wait, something came up on my thing here that said January. But I just lost what I was going to. Oh, okay, yes. It was one of the motions that I made. Yeah, the document's opening up. It says January 16th, 1998 on my iPad. Anyway, it's the May 9th minutes. My incredibly inartfully worded motion, is that language going to get cleaned up when it's actually implemented in a rule? So,
Ms.
for
Atkins,
example,
what page is it? Which page and which agenda item?
On page 4. So the motion is that they're all sent out to the board. The board's given to. I mean, it is. I am certain verbatim what I said, but it was just off the cuff, and I just want to make sure that this language will be cleaned up for some sort of a rule. or if we need to alter this. Because this isn't really proper English.
Yes, we've got our Deputy Attorney General here with us today. Would you like to jump in and try and help? Oh, okay. Let us. And which agenda item is it again, Ms. Atkins? Is 9 or?
It's on item number 9.
9? Okay.
It just was really messy.
Yeah. These hard days.
So what exactly are you asking?
I'm sorry. I was just asking if this language is going to get cleaned up and converted into a rule as part of the exchange. I just, because if not, I would like the opportunity to go back and write something out that's proper English. Because again, this was just off the cuff after discussion, and I think all of us understand what it means, but it doesn't. It's
So perhaps you
poorly.
can give me some clarification as to what exactly was this a motion to make a rule and how to respond to federal government regulations? Or what exactly was this to do?
Typically, I think the word rule means that we're going into rulemaking, and I'm not sure if that's what Ms. Atkins meant. This was a motion to establish a procedure, an internal procedure that we use so that there is a review of responses to federal rulemaking.
Okay, so there's some inconsistencies in here that would perhaps be good to clarify, because you have 2, 3, 5 days as part of the motion, and then you have as part of the motion if people are happy. So you have the option to, at a later agenda, move to rescind this action, but it would have to be properly noticed for your next agenda. This is the minutes of the meeting, so this is just a document that shows what transpired. If you are concerned about the actual result of this motion, you would need to agendize it and then rescind this motion, this action that you took. I rescind the action and then follow it up with a clearer, more succinct motion.
So then I guess my preliminary question is this language enough for staff to work from and the board, or if we need to clean it up, then I would ask that it be agendized on the next meeting and I will come up with proper English.
You know, it's my understanding, Ms. Atkins, that I think everyone on the board understands what the direction in the motion was, but just to lend some comfort to everyone, why don't we approve all the minutes except for this one and figure out a way to...
Well, I think you can accept the minutes because this is an accurate and true reflection of what transpired.
Okay.
What you would do then is you would agendize it at a subsequent meeting, an agenda item to either, for possible action discussion to rescind this action taken at the May 9th meeting.
Would that be all right with you?
That's fine. So I would move to, are we going to approve each set of minutes or all the minutes together?
I didn't hear any other edits or amendments being offered other than the one coming from you. So are there any other amendments or edits to the 3 days of meeting minutes? It doesn't sound like there is.
So I would approve to move I would move to approve the minutes as prepared and ask that, I guess I'll do that separately. I move to approve the minutes.
Okay, do we have a
This
second?
is Dr. Ford, I second.
Thank you, Dr. Ford. Any further discussion? All in favor of the motion?
Aye.
Any opposed? All right, thank you. Motion is carried. This brings us to the workshop where we wanted to solicit comments from interested parties on the proposed regulation, which is agenda item number 4. And Ms. DeRoos, are you prepared to lead us in that discussion?
I am. For the record, Shauna DeRoos. This regulation is to discuss the marketing to the uninsured. There was a Senate Bill 359 that had gone before the legislature during this last session that, to the extent feasible, directed marketing for qualified health plans to those who are uninsured or underinsured in Nevada, and that qualified for the plans and to qualified small employers that do not provide or offer health insurance. The bill did not get through. It was not approved. And so Section 2 of the proposed regulation provides the same requirements as that SB 359 would have been required if it had been enacted. So we are trying to ensure that this important piece of legislation gets integrated into our plan. In addition to that, this we want to discuss the definition of an exchange member. It was not the intent to have membership from the exchange outside of the exchange, and we are processing our fees and we are processing that membership based in qualified health plans through the exchange. And so the language change here would align that with board policy, align our language with board policy. So it would clearly limit the membership to those enrolled in a QHP through the exchange. That's the change of the language there. Is there any questions on that?
And again, just for clarification, Section 2 is the exact language that was offered in the Senate bill.
It is.
Okay. Unless there's any objection, I'm going to open it up for comment from the public with respect to the proposed regulation. So is there anyone here in Carson City that would like to testify on the proposed regulation? Okay. How about in Las Vegas?
Yes, we have one person.
Thank you. Good afternoon again, Madam Chair. For the record, my name is still Barry Gold, and I'm still the Director of Government Relations for AARP Nevada. Looking at the language in here, I question the statutory regulatory language where it says to the extent feasible and the definition of that, and also the definition of underinsured. I think for those of us who deal with this all the time, I think we have an idea what underinsured means, but is there a specific legal definition? I would have concerns about that in terms of how that's going to work. The other concern is while it says to the extent feasible and primarily to uninsured and underinsured, I think it's important, and I think the board probably agrees that it's important that the information and some of the marketing do go to everyone in the state that might have an interest and might want to buy insurance, not just those who, for example, aren't offered plans. So I think it's real important just that kind of go on the record during the workshop, and perhaps board members would like to state that as well. And like I said, my other concern would be definitions of the words underinsured and to the extent feasible, because I think that could make it a little bit unclear. So those are my comments. Thank you very much.
Thank you.
All right, do we have anyone else in Las Vegas?
No.
All right. How about on the telephone? Is there anyone on the telephone that would like to make comment on the proposed regulation? Okay. Do you want to come forward and identify yourself for the record, please? Okay.
For the record, Damon Haycock, Finance and Research Officer for the Exchange. We just received an email notification through our contact at exchange.nv.gov, public comment from the National Association of Health Underwriters in specific to this agenda item. If you like, I can read it into record now.
Okay.
It's regarding proposed changes to Chapter 695I of the Nevada Administrative Code, specifically the definition of an exchange member. Dear Mr. Hager, I'm writing on behalf of the Nevada Association of Health Underwriters, a professional association representing licensed health insurance agents, brokers, general agents, consultants, and employee benefit specialists. Our members work on a daily basis to assist, counsel, and support thousands of individuals and employers purchase, administer, and utilize health insurance coverage. Of note, many of our members are themselves independent small business owners. As such, we have both a professional and personal interest in the successful development of the exchange. We are pleased to support the proposed changes outlined in the proposed regulation EX-02-P1. Governor Sandoval stated, the exchange should stand on its own merits through user fees. He opposes funding the exchange through the state general fund or an assessment on the insurance premium tax. We support the governor's position and interpret fees assessed to non-exchange members to be tax or assessment in kind that will adversely affect consumers in our state. Our insured clients will be forced to select lower coverage plans if fees are increased. The Nevada Association of Health Underwriters appreciates this opportunity to provide our comments and look forward to working with you and the ongoing implementation of PACA. If we can be of further assistance, please feel free to contact me at 775-831-3132 or gfurr@menath.com. Sincerely, Gene Furr, State Legislative Chairman, Nevada Association of Health Underwriters.
Thank you, Mr. Damon. I listened to what you were saying. I'm not sure if they were supportive of this or not supportive, or just making a statement.
For the record, Damon Haycock, it appears from this statement on their second paragraph, we are pleased to support the proposed changes outlined in the proposed regulation EX02-P1.
Thank you. It's helpful. Okay, and then going back to the telephone, again, is there anyone on the telephone that would like to make comment on the regulation? Okay. Let's open it up for discussion with board members. I would like to make comment to some of the comments that Mr. Gold made a little bit earlier. The reason that we had "to the extent feasible" in the proposed language was something that we discussed early on. Because the marketing will be statewide, if you said "will not direct market" or was done in the reverse before. But the reason that "to the extent feasible" was put in the language was we knew that the marketing was going to hit the whole state. And our target audience is the uninsured and underinsured, not those that are already insured. We wanted to supply some sort of comfort to the insurance carriers and brokers that already have existing clients, that we were not trying to grab those clients away from them. So that's the purpose, the underlying purpose of the regulation, or the original statutory change and now the regulatory change. And I don't know, Mr. Roos, if you could maybe address some of the questions about underinsured versus uninsured.
For the record, Shauna DeRoos, we could go back and add in language for definitions of what that specifically means for the exchange. And this is the time for the proposed changes. This is the time to discuss those changes. This is not scheduled for the adoption hearing until April 8th, so we can go back and do that if it, I'm sorry, August. It was an A month. So that is something we can definitely do.
Madam Chair?
Yeah.
Two things. Shauna, if you can speak, because when you're turning your head, we can't hear you. The microphone, thank you. And if we could get a definition of underinsured, I think it would not hurt putting it in. So if we have time, I think that would be great.
Is that something that you want to try and do right now? I mean, we certainly have the opportunity
the quality
of doing
my May 9th minutes, no. Not me anyway. I'll let everyone else do it.
This is Ron Klein. I guess I appreciate the intent of the legislation, and I think we're probably all on the same page. But I think defining this more than we have already defined it will box us into a setting where we don't want to be. You put an ad in the RJ, you put an ad in the Sun, you put an ad on television, you put up a billboard. How does that possibly people drive by? So you're going to tell people who are fully insured not to look at the billboard? So I mean, I just think there's an intent here, and we appreciate the intent, but I don't think defining this any further will be helpful. In fact, I think it'll be detrimental because it'll box us into something and perhaps get us into difficulty with the underwriters who are going to feel that we haven't lived up to the verbiage that we've defined. So I think sometimes ambiguous is good.
Ms. Johnstone?
Madam Chair, maybe a suggestion would be to change instead of underinsured, have it read primarily to uninsured and those wishing for additional health insurance options. Something along that line, so that, it's in the eye of the beholder if you're underinsured. I would have a hard time imagining a definition. So maybe broaden the population a little bit that way.
Do we have any discussion on that suggestion? All right, do you want to rephrase that one more time? So we would delete the word underinsured to?
This is Leslie Johnstone. Plans primarily to uninsured and individuals desiring additional health insurance options and qualified small employers.
And from a Mr. Ron Klein, from a functional standpoint, how do you know when you're putting up the billboard? How do you know that somebody's desiring increased health insurance options?
This is Leslie Johnstone. I would just think that it would be in the messaging. So to catch their attention, the notices might be worded a little bit differently. Are you looking for additional options? You know, simplistically might be an example. I don't know if it's all that critical, but I was just trying to be consistent with the board's past action.
Okay. Mr. Bowden?
Good afternoon. For the record, CJ Bowden, Communications Officer for the Exchange. This issue, looking forward to who we are advertising to and to our target market, we are primarily going after those individuals between 138% and 400% FPL that are eligible for subsidies. There's also a large number of individuals out there currently insured and paying their own premiums that are an elevated rate that would be eligible for subsidy as they come onto the exchange because of pre-existing conditions or different health conditions. And we are definitely targeting those individuals as well, even though they're currently insured. They may be underinsured from a cost perspective, where their costs are so high, they don't get the amount of care that they would normally have, but we definitely need to be able to reach into those markets as well. And that's what we're looking to do.
This is Marie Kerr. I'm looking up the definition of underinsured on the internet. Underinsured we could define as lacking adequate coverage to protect from high medical expenses. I know it's kind of a mouthful, but if you wanted a set definition that we could put in to our regulation and really, in my opinion, move forward on marketing sooner rather than later, rather than tabling this until, several months down the line. I think that no matter what we do, we should take action today on this because, again, the marketing campaign needs to improve quickly from a business perspective.
The marketing will go as planned on it. Today is just the workshop. We have to bring it back again for adoption. They have to be two separate hearings on it.
And this is Lynn, Madam Chair. I think the key, though, is we are not going to be messaging, are you unhappy with your current insurance? Please come to the exchange. I mean, that's just not any part of what the plan is, unless I've missed some of those meetings. So, I mean, I think all of the billboard, TV, and print ad is going to be seen by everyone and anyone, and the messaging is going to be primarily to those, as CJ said, who don't have insurance or who don't have adequate insurance, wondering what adequate means, but that the target is not going to try and take away business from anybody.
Let me ask, do we have anyone on the line from the Las Vegas Chamber or from any of the brokerage firms from Las Vegas that might like to offer input? Okay.
We have someone in Las Vegas.
Hi, I wasn't planning on testifying today, but my name is Vicki Mayville, incoming president of the Nevada State Association of Health Underwriters. And the Las Vegas Chamber is having their big expo today, so I don't think they have anybody here. They already, we support this because we want to, I guess, have some feeling that you're not trying to take business from us, and you've already stated that. It's just kind of a gesture, I guess.
Agreed.
Ms. Mayville, Mayville, before you leave, please. The the conversation between the brokers and the exchange on this has been extensive, and today I think it's the first time that we've had, well, it is the first time we've had the regulation. The exchange wants to have that comfort level with the brokers because this is going to be an opportunity for you to bring people in that could be subsidized as well. So it could be more business for the brokers out there. Do you have any objection to the language as it is now, and do you think there needs to be further clarification for underinsured?
Well, I thought that Leslie Johnson's suggestion was a good one. And I don't think you have to worry about the billboards attracting the wrong person, because you're going to market to the people that need the insurance.
Do you think that changing the wording is going to help define what we do any better?
Changing it to what Leslie said?
Yeah, from what exists?
Well, you seem to be, people seem to be uncomfortable with the underinsured term, right? So it doesn't seem to matter too much to me, honestly.
All right. Well, the purpose of the workshop is to get this input, but I would like some input from the board members on whether or not they would like to consider the language Ms. Johnstone offered or just keep it as it was written for the legislative session. Because when we repost this for adoption, we need to either have the old language or the new language in.
This is Marie Kerr. I think that there's definitions of the word underinsured adequately available on the internet at this time, and that people can figure out what it means. And certainly our intent is being laid on the record. Something that does concern me is C.J. Baldwin's testimony today seems to be centering around persons who are subsidized, which I'm assuming includes the uninsured and the underinsured. But is it a larger group than that you're talking about, whom you're going to be targeting, in which case your marketing campaign seems to be somewhat not inconsistent, but a little broader than the reg. So that's just my question for CJ, the long-winded.
For the record, CJ Bowden, the marketing campaign centers around the availability of health insurance that fits your budget, whether you are insured, uninsured. If you are in the 138 to 400% FPL level, there will be subsidies out there. If we look at most employer-sponsored plans, the employer subsidizes the employee's health insurance. And in large groups, they're going to have to do so going forward in 2014 to the tune of 9.5%, the affordability standard. We are out there and marketing to people that either don't have employer-sponsored coverage or have coverage maybe on the private side, but their incomes have them fall into a more affordable insurance rate through the exchange. And there are subsidies and programs going forward that will help with the premium. So we do have a broader market because there's some people out there that currently feel that health insurance is extremely important and they pay for it, and they could find a more affordable option on Nevada Health Link rather than in the general open market.
Right, so I'm not hearing a strong preference one way or the other. I guess we could post it under both the regulation in Format A and in Format B, and at the adoption hearing decide which one we want to go with. That might give us a little bit of opportunity of getting back some feedback from Ms. Mayville's counterpart, since they're at the Las Vegas Expo. So does anybody object to that? All right. Hearing that, then we will close agenda item number 4, which was the workshop. And we're going to go to the review of the transitional informational website, which will be available June 12th, today.
And for the record, Shauna DeRose, I'm going to turn this over to CJ Bowden so that he can present this to us.
For the record, CJ Bowden, Communications Officer for the Silver State Health Insurance Exchange. In all of our marketing and outreach efforts to date, we started with person-to-person outreach at different events. That started in mid-April of this year. And to date, we've reached over 60,000 people with the Nevada HealthLink name and informational material about Nevada HealthLink. At that point in time, we wanted to develop a consumer-centric, consumer-friendly website to allow people to go to and find information that they were looking for in an easy-to-read manner that our target audience would identify with and be able to find exactly what they're looking for at the time. So our main push is to get people to go to NevadaHealthLink.com. In October, that website will transition into our web portal, so we wanted to make sure that we had a seamless transition and a website that looked very similar in each different portal, so that when people were used to using NevadaHealthLink.com for an informational site, they could also move directly into and be familiar with using the web portal. At this time, I would like to introduce Stephanie Cruz of KPS3, the designers of the website for the transitional information period. We are currently set up with the English site that is live, and we feel that Monday of next week, we will be able to launch the translated Spanish version of the site as well.
Are you able to see this down in Las Vegas? I mean, it hasn't launched here yet, but let me know. I'll tell you when it launches here. Can we turn lights off so we can see?
For the record, Stephanie Cruz of KPS3 Marketing, and I'm going to take you through a very brief overview of the transitional informational website. And here we go. All right, I'm about
20 years too old to really have this kind of hand-eye coordination, but I'm going to give it my best shot. For those of you in the room, you can bring this up, NevadaHealthLink.com, on your mobile phone or your pad. It's done in what we call a responsive design so that it optimizes for whatever device that you have, whether it's full-size screen, a laptop, or another device. So I invite anybody in the room who wants to walk along with us. We can certainly do that. Let's see. The first goal of this is to basically provide great information and education to a number of different target audiences. You'll see that our primary call-outs on the homepage are for individuals and families and employers, because we knew that that is our primary marketing targets. They are the ones who are going to be needing the bulk of the information. But if you keep going down, you'll see that we also have a call-out, a navigation button on the homepage for other partners, for example, our navigators, assisters, and CACs, and then, of course, for brokers and agents. So there are navigation buttons, but we wanted to make sure that individuals and families, who are going to be the bulk of the people visiting the website, and employers have the greatest access and the quickest access to information. As CJ mentioned, we did this design so that we simultaneously were designing web template pages to provide to Xerox, so that when the portal site launches in October, it should be pretty seamless. It's going to look a lot like the informational website. So you'll be able to see that there's a consistency of the look and the feel and the design and the elements. The second objective of the site was to ensure that the site had ample information and public education, since that is one of the components of our marketing campaign. So let me see if I can do this. Oops, that's the wrong place. How do I get out here?
Escape.
Hit escape? Okay. Could you drive?
I can drive.
Okay, I'm going to try to get to the glossary of terms under individuals and families.
I'm a Mac user, and this is just way over my head. So if you look at need more information, glossaries and terms. It has a feature that if you scroll over a term that might be too complex for someone who is reading the website, it highlights that term, and then a window pops up and gives the definition of, say, insurance or copays. So it has a lot of information and complexity that allows, like there, for example, that pops up and it kind of talks about what federal poverty level means in common terms. So that has a lot of education and information, which is part of our phase 2 goal, which is public education and information about what insurance is and insurance terms, but also that the exchange is coming and what that means to them in October. You'll see on the homepage that we did translate the calculator, the federal poverty level calculator, into the new look and feel. It allows people to enter their annual income, and it'll tell someone whether they're eligible for a subsidy.
So if we take $34,876 and a individual family, we'll go ahead and calculate that rate. And it's doing nothing at the current moment, but it does.
It does calculate
and come up with the correct second lowest cost silver plan cost for that individual.
So it has several pieces of education and information for consumers as well as employers if you want to kind of play around on the different sections. The FAQs under each section, they're segmented by target audience, and they were derived from FAQs, from actual questions that the exchange staff has received over time. The FAQs are sortable, so you can sort and search for a specific question that you have in mind. The entire site is also searchable, so that if you have a piece of information that you're looking for, like key dates, you can search at the top and it will let you know where to go on the site to find that information. It has target markets that are represented and appropriately. If you look at the imagery at the top band, as a refresh, you see it represents a diversity of types of populations. We also have the true translation is coming. It's not one of those where you press a button and it tries to translate the site. This will be a true Spanish translated site, and again, that will be available Monday. We're having a translation overlay done just to double check our translation. Each page, as you see on the bottom of each page, will link back to the Silver State Health Insurance Exchange agency site. We did put the state of Nevada seal on there so that people realize that it's sponsored by the state of Nevada. Our research has indicated that that is important for people to know, that it is government approved and it is regulated and approved and offered by the state of Nevada. When the navigator and assister list is filed, we'll be publishing that. It will go on a very prominent call out on the homepage so that people can find out where to go to find a navigator or assister. And also we'll be adding that to help, the help section. The content management system is a very easy to use content management system. It is going to be very easily updatable by staff and also by KPS3 staff. So, and again, we made sure that there was easy access to contact us and help on all pages. And that is my quick overview of the site. I invite you to look through it, look around. The information and the messaging was based on a lot of research, both nationally, secondary research, and a lot of our focus groups that we've done to date in terms of phrasing. And we've vetted it very carefully with the exchange staff to make sure that our language was appropriate given the federal language and, again, appropriate to our language and education level. Thank you for driving.
For the record, Shauna, Stephanie, can you tell us, the calculator is not working right now, but can you tell us when it will?
It is working. I think we just have to wait for it.
We're trying it up
we
here.
Can't get it to work here either.
It doesn't appear to be working. So.
All right. I will text the office and see what's going on with that one. It was working yesterday because we were playing around with all the different
Everybody wants
levels.
to play.
So. Yes.
And for the record, CJ Bowden, that was actually one of the things that delayed the start of the website. We were going to launch on June 3rd, but we had to make sure that that calculator was 100% correct in the calculations that it did and calculating the second lowest cost silver plan. So that delayed the start until this Monday.
Stephanie Cruz for the record. If you click on View More Key Dates, that takes you to a calendar of events that are where the exchange staff or KPS3 outreach staff will be in terms of presentations, presence at events, and that type of thing, so that if somebody wants to attend an event and hear more from someone, that is where you would go to find that out. And I'm sure as the navigators and assisters get more robust in their activities, that will get filled up very quickly.
Right. Do we have any questions from board members?
Madam Chair, Lynn Atkins for the record.
Yes.
When you click on the individuals and families, the 3 pictures that come up on the left on the bottom, those pictures don't change out. Is that right?
No, those are kind of fake banner ads, so they don't change out.
So can we, could you possibly look at diversifying those pictures a bit? I'll just leave it at that.
And if I understood Ms. Cruz right, these are the spot areas for advertising. So these will...
No, for the record, Stephanie Cruz, those are, I call those fake advertising. They look like ads, but it's one more way to navigate to an individual, to a section that calls out. So it looks like an ad, but it's basically an image that will help people link more quickly if they can identify that, oh, I need to go to an employer area.
This is Marie Kerr. Is the globe symbol commonly recognized as the language translation? Because when I was navigating around the page, my first question to self was, where does it say in Spanish? Would it be simpler just to put en español or something on it rather than putting on the globe? Just a thought.
For the record, Stephanie Cruz, we could certainly do in English and in Spanish on the top as a call out on the bar in words.
Yeah. For the record, Shauna Durus, the globe symbol came from the federal government actual guidelines, the UX
2014.
Yes. That actually was called that. And I only know that because I asked the same question yesterday. So that's why we are using that globe, is because it came from the guidance from the federal government.
And for the record, Stephanie Cruz, this is, as Shauna mentioned, this is based on best practices that the federal government did to guide on portal web developers and other web developers in what things should look like. And it gave a lot of great advice. But if we wanted to do something in addition, we could certainly put it as a sub-nav under individuals and families, for example. Just one more way to make sure people realize that they can translate it.
And as well, the Hispanic population, for the record, CJ Bowden, will receive the Spanish URL as well. When they type the Spanish URL, and it will come up with the Spanish page as well. When they go to the translation, it will send them over to that URL, and vice versa.
And for the record, Shauna Durus, in Nevada, we're doing this in English and Spanish. In, say, California, where they're doing it in many, many, many languages, the world represents the entire world in all of those languages. We could put that English and Spanish on ours because we are doing the 2 dominant languages in the state, and we may decide that is simpler if we go that route.
Yes, Ms. Johnstone.
This is Leslie Johnstone. I have concerns about the calculator. I know that most of the exchange sites are putting that on, and it looks very helpful. But when we don't know what the premiums are, I think we are really subject to misleading people, even if we put disclaimers there.
For the record, CJ Bowden, we thought about that long and hard at staff level at the exchange, and the premium numbers that we're giving out are for the second lowest cost silver plan on the exchange, and those are set in the ACA. But a person could buy down to a bronze plan and have a much cheaper premium. They could buy up to a gold plan and have a more expensive premium as well.
So this is Leslie Johnstone. I haven't understood that the federal government decided what the second cheapest silver plan was.
Through the advanced premium tax credit, when a person enters their income and they're between 138% and 400% of the federal poverty level, the federal government their U.S. Treasury is going to give an advanced tax credit to them on a monthly basis that will pay for the remaining portion of premium. If we go to the site that says affordability or income-based costs, if we look at this diagram here, for a family of 4 that makes $47,100 a year, that puts them at 200% FPL. If we scroll down to the cost, which that cost calculator does, the outline cost is $247.28 per month, and that covers all 4 of the individuals on the second lowest cost silver plan in their area. It doesn't matter if they're in New York, if they're in Minnesota, or if they're in Nevada. The federal government is subsidizing that remaining cost over and above $247 to each of the insurance carriers, and that's what the advanced premium tax credit is. So for that section and the silver plan, if the person falls in those income ranges, that will be their premium.
Thank you. So the calculator is only going to show that one level?
Yes, the calculator, and if we go back to the main page, the home page, besides the disclaimers that we have put on, we have calculate your silver plan premiums. They could buy down and have a cheaper rate if they were to purchase a bronze premium, or if they were to purchase up, they would have a little bit more expensive premium. And we have the disclaimers through here with the different dollar amounts and what buying up or buying down could be.
This is Leslie Johnson. I appreciate the disclaimers, but people need to get that far to see it. And it implies that you're going to see all of the silver plan premiums. And truly, all you're going to see is your cost for whatever the second lowest silver plan is.
That is correct.
I think it's misleading.
This is Dr. Ford. Maybe the issue is the banner, that instead of saying monthly premiums under the second least expensive, it'd be monthly cost. I think maybe the issue is the word premium. Ms. Johnstone is thinking about what the insurance premium is, and what you're really trying to communicate is the patient's monthly cost. So maybe it's that word that's the issue, the word premium.
Well, I think my concern is it looks like you're going to see what your options are. And truly, you're only going to see one figure. And at a minimum, you're not going to see all the silver plan options. So it would give me the impression that I'm going to see all of my choices, and I'm really not. But
this is Lynn. I'm wondering also,
this is kind of a standard that the exchanges are doing.
What about also changing the word calculate to estimate? I mean, because calculate sounds quite final, and estimate sounds not so final.
Well, it's not it's just reading off of a table for one item. It's not really calculating based upon any information other than that one set of variables that the federal government has set. To me, it implies way more than what it really does.
One, and I guess the only other comment that I would have is when I've taken the demos out, this is the part that gets people the most excited, and it's interactive with them. So maybe there's a different way of phrasing it, at only one level.
This is Jeff Mullenkamp. When you go to the next page, if you go into that next page, possibly what you could do is have, there in bold print, this is what you're getting here. There are other costs and plans available, and maybe not in a disclaimer down below, but when you actually go into it, it shows you what your plan cost is. Maybe it should say that this calculates the second lowest cost. There are other options available to you at higher and lower cost, but maybe make it more prominent so you can see it and so you can understand what it is that you're not seeing. So I understand your concern, and I think it's a valid one. I think that the problem is it's down in disclaimer in more legalese language, and I don't think people are going to get that. And I think you're right.
Marie Kerr. First, I do think that, coming from the standpoint of a person who buys insurance for their business, and who's bought individual plans in the past, the calculator is very exciting to me. It's like, oh, now I can figure out how much I'm going to owe. The second thing is maybe you guys can give a range, because what you're really looking at is a range going from the lowest bronze to the highest gold. The range might be better, because if I see just one and I've got a million other things to do, which I normally do, I calculate, I'm paying less now. But if I look at it and I go, I could possibly, pay limping, because I'm not just looking at the middle range. The giving a range might be better. The final point is this thing really needs to be working, and with, as we're going through the if we're trying to calculate and we're all pressing buttons and it's not working, that's not a good thing, because with marketing things, I think you probably, get one shot at people going in, and if they look at it, it doesn't work, you're going to have a problem. So it needs to be up and running.
And I think that the agenda today was really just to give us a peek, and not for us to critique it at this point in time, because I know everybody's working very hard on it. So do we have any other questions for Ms. Cruz? And if not, we'll move on to...
This is Lavon Lewis, and I was just going to comment, instead of calculate, since there was such concern about the fact that it's not really calculating your silver plan premiums, perhaps we just could say display, since that's really what's going to happen, and you would put in whatever the information in, and then the premium would be displayed on the screen. That's just a thought.
Good thought. I know everybody's taking notes here. So any other discussion, or shall we move on to the next agenda item? All right, we'll go ahead, and the next item is the demo by Xerox and Choice Administrators. Is this something that we need lights down for as well? Okay. Have you come forward and identify yourself for the record, please?
For the record, Chad Hogan, Choice Administrators, part of the Xerox team.
Thank you. Welcome.
Thank you. Thank you, Madam Chair. Board members, Mr. Roos, thanks for the opportunity to present to you the work that the Xerox and Choice team has been putting together over the past several months, and in working with staff to put together the Nevada HealthLink Exchange site. Today we're going to walk you through some of the key functionality from a demo standpoint. We're going to look at the individual streamlined app, the one that's based upon the guidance that has been put forth by CMS. This is the application designed to collect information from consumers to help determine their eligibility for public assistance programs. The Nevada Streamline app is unique in that it is not only determining eligibility for federal assistance, but also for state programs such as CHIP and Medicaid. And we'll see where there's some specific questions in there that address Nevada state programs. I'm going to go ahead and click onto the home page here. Give me just a moment. And while that's coming up, I want to just talk a little bit about what you're seeing in front of you. Now, this is a first release. We gave a presentation to the Exchange staff yesterday, and wanted to call out just a couple of things. You're going to notice that the styling is consistent with the marketing information that was put out by KPS3. We've been working hand in hand with them to collaborate and put together this design. As we go through this, you will see the design applied in various ways, and as it was mentioned, the overall feel, the functionality was based upon the UX 2014 guidance. The UX 2014 guidance was put together about a year and a half ago as a working group of individuals from CMS and industry to put together some best practices for.
Excuse me, could we ask you to either speak up a little bit, or I'm not sure if the microphone's right in front of you. We're having a difficult time hearing. Thank you.
I'll move it closer. To put together the state-based exchanges or the federal-based exchanges. Is that better? Okay.
Yeah, a bit. Thanks.
All right. So in looking at the site, there's a couple of key navigational items, again, targeting specifically to individuals and families as well as employers. And as you saw on the interim site, As we scroll to the bottom, you'll see a lot of the same type of content, links for partners, navigators, the state seal, the link to the Silver State Exchange. While some of the navigation is consistent, the globe there for English or Spanish, calling out a couple of new items such as the Get Assistance. Again, key is helping consumers find assistance going through the site if they have questions. Not only email and chat, but also a toll-free number and the ability to find a local assister, be that a broker, a navigator, an application counselor, etc. Right in the front is the call to action to start their application for health insurance. Now, for the purposes of the demo, I've gone ahead and pre-registered with the exchange, so I'm going to go ahead and click on the Apply Now and then log in. We're going to run through a sample application for a single individual who would be APTC eligible. They're just above the Medicare and CHIP line, so they would receive federal assistance for their health plans. So let me go ahead and log into their account. And as soon as I sign in, I'm presented with that Streamline application. But we will display to the consumer the exchange's privacy policy, which will inform them about the information that will be collected by the exchange, how it will be shared with various government agencies, and to whom it can be disclosed by and when. Now, you'll notice along the side, we have a left navigation that walks them through kind of step-by-step where they are in the process of the application. Gives the individual an idea of how much is involved and the amount of effort to go through each of the steps so they can track their progress along the way. The content that you see, the way the questions are asked, how they're presented, that comes directly from the CMS guidance in regards to filling out the application. So you'll notice down the bottom we have a Save and Continue option. That's there specifically so that the consumer knows at any step along the process they can save and come back in and resume their application. Now I've gone ahead and staged some data in this application just to make it quicker from a walkthrough standpoint. So we're going to be filling out an application for a gentleman by the name of Horst. Resides in Las Vegas. Provided his phone number, an email address. There are options for preferred methods of contact, including email, mail, etc., as well as defining their preferred language, whether it's English or Spanish. If there's someone that they want to have as an authorized representative, they can declare that individual's information, as well as if there's someone helping them fill that out, they can fill in that information and collect that. I'm going to go ahead and click Save and Continue. And now we're going to start asking them some questions about who they need coverage for. Are they looking for it just for themselves and other family members, or maybe they're completing this on behalf of other family members. In this case, Horst is looking for insurance just for himself. And one of the key things that came out of the guidance from CMS and as well as New York's 2014 is identifying the individual. So as you see through the questions, we'll call rather than applicant or spouse, we try to use the individual's name, personalize the application, make it be more interactive to them. And then we're going to ask them a question if they want to find out help paying for health insurance. In this case, we're going to say yes. And then we're going to ask them to fill out some information about them. If there's other applicants, even though they initially said themselves, they can still add them in the process. From an eligibility standpoint, we need to ask them if they have other members in their household. We have to determine the size of that federal tax household, and this is where they would provide additional information about other members in their household who are not seeking coverage through the exchange. This is a page that it's in between. If there were multiple family members here, it would go through some of the questions and ask these in detail about each family member, but we're going to specifically answer questions here for Mr. Horst. We asked some questions regarding filing for taxes, etc., to help establish their APTC eligibility. We'll ask marital status question, again, building up that tax household. Now, you'll notice the questions are asked one at a time in straightforward English. And the idea here is rather than overwhelming an individual if they get on a certain question and there's maybe 3 or 4 or 5 questions per page that maybe they need to go look up for information, they can always save and come back to the most recent question. We will ask them to provide their social security number. This is required to establish a couple of different things, but the eligibility engine uses it to determine residency status, incarceration status, those kind of things via the federal hub. If an individual does not have a social security number, we provide consumer counseling notices in regards to how to obtain one. Also, if they don't know what their social security number is, we provide the numbers to contact the Social Security Administration to retrieve that information. Of important note is that as you go through the application, at no time will the consumer actually be stopped and prevented from completing the application. They'll be able to complete it with as much information as they have available, or if they are unable to provide that information, they will come back and they will have a reasonable opportunity period of 90 days to supply that supplemental information as part of their eligibility determination, but they won't be held up and won't be able to continue through the process. We're going to ask them to establish their citizenship. If they answer no, then we'll prompt them to provide additional type of information. Do they have legal immigration status? If they do, provide documents, etc. in the process. So for the purpose of this, we are going to say that yes, we have a U.S. citizen. Ethnicity is a demographics request. They're not required to fill out anything on this page, so I'm going to go ahead and skip that. However, if they want to designate their ethnicity, they can. We are required to ask if they are an American Indian or Alaska Native to establish eligibility for reduced cost sharing for those tribal or Alaska Native members, as well as special enrollment rules that they have access to. Once we've collected the information from a basic personal information standpoint, we're asking them to confirm that they're living at an address that is within Nevada. We're going to ask them some income information. Let me go ahead and just go through the rest of these quickly. And that income information will be used to establish their federal poverty level for APTC or Medicaid or CHIP. So in this case, we're going to ask what they expect their annual income to be in the coming year, because this is based upon their 2014 tax return. So we're asking them to estimate what they believe they will earn in the coming year. And then we have a Medicaid question that comes in and asks do they believe their income will be greater than a certain amount in a given month. In addition, we're then going to ask them to define where that income comes from. Yes, it's from working. It's from a job. There's various other sources of income that they can supply. And then since it's from a job, we're going to ask them to provide the name of their employer, how much they're paid, and how often. Now, you'll notice that we have a variety of different options in here. Individuals maybe don't know exactly how much they make monthly or annually or biweekly. They just know what they get in their paycheck or how much they get paid per hour, and so they can choose the method that represents the dollar figure that they put in up above. In addition, they can add multiple jobs. We're going to ask if they have any options, and this goes towards, from a technical perspective, calculating their MAGI, or modified adjusted gross income. If there's deductions or other things that could have an impact in reducing their gross income for eligibility, they could provide that information here. And then we provide a summary. Now you'll notice as we're going through here, items are being checked off, and you can see as we're proceeding through, I can see where I am in the process along the whole application. We're going to ask now about monthly income. Again, this is driving towards some of those integrated eligibility questions for the Medicaid and CHIP population. We're also going to ask if there's other access to insurance, either directly through an employer or from another individual's job. And this will help establish levels of uninsurability and other metrics as individuals come in to the program, as well as if they do have access to other minimum essential coverage. So we're looking at other types of coverage such as COBRA, retiree health plan. On the next page, we'll ask questions about public programs and if they are currently enrolled or have access through current public programs. And then we'll go into the Medicaid and Nevada checkup specific questions. We've already answered previously that there was no other coverage, so the system assumes that and answers no. But if they do have another form of health insurance, they can answer it here as well. Do they need help paying for medical bills? And then they're given, at the end, an opportunity to review their application. This is a summary of all of the sections of information that they previously entered. If they wanted to go back in and edit a piece of information that looks inconsistent, then they can click Edit, and it will take them back into that area. I'm going to scroll through everything down here to the bottom and click Save and Continue. And at this point in time, we'll then ask them to sign and attest to their application, specifically indicating that no one on the application is incarcerated or in jail, and that they agree to inform the exchange of any changes that might affect their eligibility, and that they are answering truthfully to the best of their knowledge. And once they're done, they will click Save and Continue, and that will then be, I'll go ahead and do this. Test. Yes. I agree. I'm going to type in the name here. And I'm going to save and continue. Now, along the way, we've done various eligibility interface requests to determine information. And at this point in time, we're seeing that, you know what, there's a discrepancy in the income information that was presented versus what we see according to the records. So we're going to ask the individual to submit proof of income. They don't need to do this to save and continue. They are provided with a deadline to submit the documentation for that. And if they want to attach that, they can choose a file, go out and pick, say, their sample pay stub, and attach that directly in, or they will be provided with additional contact information by where to send that supporting documentation. At this point in time, if we were to hit Save and Continue, we would go out, hit the Eligibility Hub for final determination, and come back with the appropriate results. That's something that is not in this initial release, but we've walked all the way up and through the final eligibility determination. So, Madam Chair, any questions?
No, that was very interesting. Have any questions from board members?
Yeah, I have a question. This is Dr. Ford.
Yes, go ahead.
So this pay stub thing, I must have missed this in the application. So every applicant has to provide a pay stub that works?
No. There was an eligibility determination. In this case, as I mentioned, we are hitting the eligibility engine multiple times. One of the things that we looked at was their income. In this case, there was a deviation. This is an example of a deviation in their income from what they reported versus what we saw back from the Eligibility Hub. And since we know there's a deviation between those, we're going to need documentation. So we are upfront letting them know that in order to fully process your application, we're going to need some additional documentation.
Oh, okay. Thank you.
Normally, this wouldn't show if there was not a deviation of 10% or less in their income.
Okay, got it. Thank you.
Ms. Johnstone?
You guys there?
We can't hear you if someone's speaking in the north. Hello?
We had a little technical issue. This is Leslie Johnstone. When you say Eligibility Hub, is that the federal data hub?
So there are two elements to the Eligibility Hub. The first is a integrated eligibility hub that looks at not only the Nevada specific program.
We cannot hear anything.
Hello?
We still cannot hear anything. We
Is
heard
that any
Ms. Johnstone's question.
I can't hear your answer.
No.
Hello?
Still nothing.
Now, we can hear that.
So there are two eligibility engines. The primary one is the federal hub. The secondary being the Nevada-specific eligibility engine that looks at state programs and state-based information to determine eligibility.
Okay, thank you. Then my other question is this the level of detail that will suffice for the federal review of the eligibility? And the one that caught my eye was Alaskan or American Native. You can just say yes or no, and that's it?
No, so why don't I go ahead and we'll go back, and I'll navigate back specifically to that section. But if I were to answer yes to that question, it will then prompt me, am I a member of a tribe? If so, which tribe am I a member of? What type of documentation can I provide? On assumptions, they're all responsive. So if I answer yes or no, it will prompt me for additional information. The idea is to ask the consumer the minimal necessary amount of information for them to proceed through the application.
Okay, thank you.
Ron
Do
Klein.
we have any other questions?
Yes, Ron Klein. I may have missed this, but is there any kind of identity verification as you do this process, and does that matter?
So the identity proofing process is handled as part of the sign-up. That's not in this initial release. If you'd like, I'd be happy to walk you through how we create an account, and I can show you where in the process that identity proofing would occur. But the individual will be presented with knowledge-based authentication questions via the hub from Experian, providing that knowledge-based authentication. It's a similar process that I'm sure we've all seen in the past when we go request a copy of, say, our credit report, and we're presented with 3 questions that only we should know the answer to, like, you had a mortgage in 2001, how much was the monthly payment? Something like that, and those knowledge-based questions.
Okay.
This is Lynn Atkins. I have a couple of questions on the income request, because this person needed to supply some additional income, and it says if you can't attach it by PDF, you can mail it in. What's the plan on the process? It gets mailed up to Carson City, and then what's going to happen with that document? Is Exchange staff going to take that, scan it, email it to who, or is that Xerox staff? What is the plan on that, if we know yet?
Yes, for the record, Shauna DeRoos. So they actually did have our address here at this location in this demonstration. However, that will not be the address that stays on this application. There will be a P.O. box provided and the information will go to that P.O. box. There will be daily, even more than once daily pickups of that information. It will go through the document information system through Xerox, yes, through that contract. It will get tagged, it will get assigned to that account, it will get uploaded into that person's account, and then there will be a flag that comes up and says, documentation has been attached to this account. So there is definitely that methodology. It will not come here to the Silver State Health Insurance Exchange office.
Excellent, thank you. I have another question on the deductions page. If you could get back to the deductions page.
Just a moment. Find the specific link here. Okay. Okay. So go ahead and click on the yes.
Thank you. You answered my question.
Very good. I'm glad it was that easy.
Do we have any other questions? Well, if not, thank you very much. We very much appreciate the demonstration.
Thank you very much.
I know you've been working long and hard on this. We do have, next item on the agenda is the review of the decision support videos created by the Massachusetts Health Insurance Connector.
For the record, this is Shauna DeRoos. So the Massachusetts Health Connector has these very short, you can see the first one there is 1 minute, 7 seconds. They have short videos, and I believe it was Dr. Klein that brought these to our attention, that kind of gives brief moment in time of, what is a provider network there? What is co-insurance? How do we explain these things? And I think that the intention was that Dr. Klein had was just to provide us with these. Are these something that we could have on our website? Is this something that we would find beneficial? And it was just to bring these to your attention and open it up to, the possibilities. Chad, if you could hit one of them and we'll see it real quick.
Turn on the sound.
A provider network is a group or network of doctors, hospitals, and other medical professionals who have agreed to serve the members of a given health plan. Different health plans likely have different networks of medical providers. So while two health plans may offer the same benefits, the doctors and hospitals that accept that particular health plan may be different. When choosing a health plan, you should consider the provider network you'll have access to. Some health insurance carriers offer health plans that have the same benefits, but have different networks of providers. Where that happens, the options with smaller provider networks are specifically flagged for shoppers. They have a lower monthly premium, but fewer provider choices than available from under that same health insurer's biggest provider network. If you have a specific medical provider that you would like to continue seeing, whether it's a doctor, nurse practitioner, or a hospital, you'll want to make sure they participate in the provider network of the health insurance plans you're considering.
So for the record, Shauna DeRoos. So these are little glimpses and pieces of information that people may want to know. We did reach out to the Massachusetts Health Connector. We asked them if we could use these, who developed them. You saw that they're very generic, except for right at the end, when their name comes up, we could replace that with Nevada Health Link. They have not responded yet. Part of our question was if these were funded with 1311 ACA funds, then technically that means that they should be reusable to all the other states. So we will continue down this path, but Dr. Klein, did you have any specific comments that you wanted to make on this?
No, not at all. John sent me on a 10-hour jaunt to Washington, D.C. to sit on a panel. And I sat on a panel with somebody from the Massachusetts Health Connector who mentioned these videos. I think it's a YouTube channel, isn't it?
Yes, these are on YouTube.
Yeah. And I just thought that was a brilliant idea to use. So yes, no, I just think it solves a lot of the problems. Because I think one of the conversations we've had here many times is that a lot of people will be purchasing insurance for the first time who aren't familiar with some of these terms. So this seems like a great solution to that problem.
So I would say that once we get a response back from the Massachusetts Health Connector, we'll bring that information back to the board. And today it's not on as it's informational only, I believe. But once we have more definitive information for you, we can bring that back and possibly make that decision at that time.
Yeah, and I think, John, you mentioned that they'd gotten back to you because when we emailed a couple days ago, I offered to speak to this person who was on the panel with me, and you said you didn't need to because they'd gotten back to you. So.
Well, and I agree with Dr. Klein.
I'm sorry. I thought John was up there. I'm sorry, but
no.
He has been remarkably quiet today. So that's.
No, he'll be joining you down there. He had a commitment that he should be joining us or joining you down there momentarily. But when Dr. Klein called me about it, and I Googled their website and looked through it, I really thought this was a great idea, because even for people that have never been insured, if you pick this up and work on it just once a year or something, you need to refresh yourself on what all of it means.
Hopefully, I mean,
pleased.
really, every state is going to be dealing with these exact same issues. So it'd really be wonderful just to share rather than reinventing the wheel. We all have enough work to do, to use these. But we'll see how Massachusetts feels about that.
Well, if not, it sounds like it would be easy enough to recreate. I think once it's on YouTube, though, isn't it public domain?
Yeah, I don't know if you can.
I'm sure we could link to
Yeah, you
it.
could theoretically link. I mean, I don't know what the legal implications
Yeah.
would be of.
I'm
just
sure we'd
linking
have
to
to
the
have
YouTube
somebody
channel.
check on that.
The thing is we definitely could link to these right now, but they say Massachusetts Health Connector on them. So.
At any rate, thank you, Dr. Klein, for bringing this to our attention. I think it would be a great thing to add to our website. So why don't we take a 10-minute break? How does that sound? And we'll come back on the record
Wonderful.
at about 2:40.
Yeah, and now they got that new guy.
All right, are we ready to go back on the record? Hear us. All right, the next item on the agenda is agenda item number 8. It's discussion and possible action regarding the semi-annual NRS 695I.370 sub 1 sub B fiscal and operational report to the governor and the legislature. So, Mr. Roos.
For the record, Shauna DeRoos. Yes, here we are once again. It's hard to believe we've done so many meetings already. But at the end of June, we are required to submit a fiscal and operational report. In your package, you'll see that there is the draft letter to the governor and the director of the Legislative Counsel Bureau submitting the report. The report itself has grown to 22 pages. Much of the information is similar to past submissions with obviously notable additions since last December. The report itself is the holistic view of the exchange. So we don't remove the past information. We want people who pick it up for the first time to understand what is the Silver State Health Insurance Exchange, how we came about, what we're doing, the governance, the board, things like that. For today, I would say that some of the new information that is here specifically falls under the regulatory and statutory actions. We talked about the legislative session. We talked about the Division of Insurance's Bill AB 425 that was approved and what that did for the education requirements of our enrollment facilitators. We also included a section on rebranding and advertising of the exchange. That has occurred since our last report. So page 9 of 22 in this draft. We talked about KPS3's contract, some of the dates, some of the things that the board has decided. We've got a lovely picture of our logo here. And then we also included on page 10 the Nevada HealthLink Summit that is occurring tomorrow and Friday. So we got to include that in this particular draft. There's an extensive list over the next few pages of all of the outreach and meetings that we have done presentations to. And then there is the Navigator, Enrollment Assister, and Certified Application Counselor pages. I see a misspelled word there, counselor, that we can fix since this is still in draft form. And we talked a little bit about the business operations of the exchange, where the eligibility engine is currently, where the BOSS solution is. We added a section for IT project risks. Last December, we didn't have those risks identified. We've had a few come up and how we've mitigated those risks and handling those. And then we go into the finance of the report and where we are as of June 3rd, 2013, where we were fiscally. So with that, I can answer any questions.
Great. I'll open it up for discussion. Do any board members have questions for Mr. Roos? Yes. Ms. Johnstone.
Ms. Leslie Johnstone. First, I think it's a very good report and gives a picture of what's going on and the work that's gone into the exchange. My only comment was in the vendor section. You know, because the grant funding from the federal government is so large, it seems like a obvious question about where that money is being spent. And my thought was in the vendor section to indicate of those contracts that have been let, the amount of for those contracts and the term, effective date and termination date of the agreement. And then if it's practical, some idea of if those resulted in any Nevada jobs. You know, did we keep the money in the state kind of thing? But it might give the reader a better picture of where those $70+ million are going if we can list out how much of it needed to be dedicated to those major efforts.
Vendor. I'm not
Thank
sure
you.
what the vendor
I think that's a great. Can you
Yeah,
show
that's a great
which
idea.
page on vendor? I think we're looking for that.
So page 19, I think we start talking about the consultant and actuarial contract you can see there.
So finance. you mean
Throughout the
section
whole
level
thing, we
finance?
mentioned the KPS3 contract, the eligibility engine. Under the technical infrastructure, we mentioned eligibility engine, we mentioned the BOSS and the Xerox contract. We could add a section specifically that say contracts and list the amount, the termination date, and I can ask the vendor specifically if it resulted in new Nevada jobs. We could also perhaps put how many people are in Nevada working on this project, or how many people in general, because I know, especially with Xerox and Deloitte, there are people working on this project outside of Nevada, but some maybe not. Some people have moved here, so it may not necessarily have been a new job in Nevada, but people have moved here. People are coming here to work on a weekly basis, and therefore spending money in our community. So maybe that, if I can't get a brand new job.
Yeah, this is Leslie Johnstone. That's why I prefaced it with if it's practical. And specifically, I was looking at the section in the middle of page 20 where they seem to be together.
I know we haven't gotten there yet, but the call center is going to be Nevada jobs, and that might be something.
We can certainly go back and make that
Those
revision.
will all be new Nevada jobs.
Yes.
Yeah.
I think it's a great idea.
Do we have any other comments or questions? All right, then we'll move ahead with those edits on that. And did we want to wait for John for item number 9?
So, Madam Chair, I do believe that on this we need to approve the letter to the governor and legislature and the report. Since this is due at the end of June, I would not have an opportunity to make those changes and then bring them back to the board for additional review. If you could make your motion to include that we could make those changes and submit, and then you would get to see them along with your letter.
Okay.
Would that be?
That's fine with me. Is that fine with the board? Then we need a motion to approve with the recommended amendment.
This is Leslie Johnstone. I'll move approval with the recommended amendments to the vendor section on page 20 and give staff the administrative authority to incorporate that in the final version.
Is there a second?
Second, Lynn Atkins.
Okay, thank you. Any further discussion? All in favor of the motion?
Aye.
Any opposed? Motion carries. Thank you.
Mr. Hager should be here any moment per a text. So I don't know if we want to wait for the next item with him.
I'm sorry, I didn't hear what you said, Ms. Atkins.
Mr. Hager should be here any moment based on a text he sent 20 minutes ago.
Okay. We don't have an action item, but I think Mr. Roos is prepared to do the executive director's report. Why don't we go into item number 11?
For the record, Shauna DeRose, the executive director's report includes a recap now that we are through the 2013 legislative session. I think here that there were some important notes, especially that SB 352 was not enacted. This related to the exchange of that would allow carriers or brokers to be appointed to the exchange by removing conflict of interest standards. That was not enacted. Revises the duties of the exchange. SB 359 was not enacted, which has resulted in the regulation that we discussed earlier today. SB 454, which was not enacted, and that was the exchange bill. And we've discussed that previously. AB 425 was the Division of Insurance bill that was enacted, and that does have a great effect on the exchange. It allows the Division of Insurance to certify navigators, enrollment assisters, and certified application counselors. And we will be working with them to create that ability and create that plan, create the testing model, create the curriculum, and moving forward with getting the EEFs certified in the state. There are several other bills of interest here. The status of the exchange implementation regulations continue to come in. We are still awaiting final regulations on several areas that are very important. The IRS proposed rule that came out on May 3rd and comments due on July 2nd. I believe that per the agreement with the board, John, the executive director, will be sending out his comments for your review very shortly, probably before the end of the week, so that he can get those in by July 2nd. We've had several rules that have come out that we haven't submitted comments, and there's been some finalized regulations. Again, I think that the important thing here is that Medicaid and the exchange and CHIP and all of the programs that are involved in this implementation are still awaiting those final regulations from the federal government. And I know it's frustrating, and I know that some of the things that we've talked about and enacted now are based on some of those things. So depending on where they go, we may have to come back to the board with some changes. So the technical implementation of the BOSS and the eligibility engine, I'm very happy with how this is going. We've had a tremendous amount, again, of paperwork come through this last month. Next Thursday and Friday, the 21st, 20th, and 21st, we are scheduled for our final detailed design review. This is 2 days of us working with the federal government. We will be going, like it says, final detailed design. We will be going over the plans. We will be going over our documentation on the eligibility engine side of the house, as well as the BOSS side of the house. And there's a list here of the documents that have been submitted to the federal government in support of that design review. And it's an exhaustive list here, and thousands of pages. The revised project schedule alone, we started this with a 1,200 line project schedule, and we are now to a 5,300 line project schedule. So it just expands constantly. Also, attachment A includes that high-level roadmap that we like to present to you monthly, and it shows the progress of the BOSS and the implementation. Everything is on schedule right now. We had risks reported in the last executive director's report. Those risks, nothing has changed. No new risks have been brought forward. And so the project risk section here indicates that. The carrier onboarding section, we've completed all 11 group carrier onboarding meetings. They were very well represented, very well attended. Staff and Xerox and Choice administrators answered many questions over many hours of conversations with our carriers. Navigators and enrollment assisters, we have agenda item 10 today that we will look at there. And the marketing and advertising, I think you've gotten a glimpse today of what KPS 3 has been working on. They've been working on the marketing and advertising campaign. Phase 2 is starting up. We have been working on the summit. They've been helping us with that. So everyone is very, very busy there. So we have upcoming events on page 8 of 10, and we've got the last day for the carriers to submit the plans was last week, June 7th, so that was a very important day. We've got our summit this week, and for us, the FDDR next week, so very important things coming up within the next month. And then the board calendar. And with that, we can take any questions.
You have any questions for Mr. Bruce?
This is Leslie Johnstone. On the plans submitted by the carriers, when will we know who submitted those plans?
For the record, this is Shauna. I don't have that list, but it appears that Mr. Bowden does.
For the record, CJ Bowden, Senate Bill 425 from the DOI that passed, and the plan information and rate information will not be available until September 1st of 2013. Right now, we have a request into the Nevada Division of Insurance for the names of the carriers who have submitted so that we can release those names to the public and do a press release as soon as possible.
September.
California already released them.
With the names as soon as possible.
Yeah.
So, but we don't have a problem of confidentiality with releasing the names.
Currently, at the time the rates are filed, when those are, or excuse me, the binders for insurance plans are filed at the Nevada Division of Insurance, that becomes public record, and we're just waiting for that information. We do not have access into the CIRCON system or the HIO system that they were submitted into, or the CERF system, so we have to get that information from the Nevada Division of Insurance.
Okay, and we've made that request already?
Yes, we have.
Okay.
And I'm sorry, this is Lynn. So we think this is going to be after September, or no?
Currently, we're trying to get the names of the carriers who are providing qualified health plans on the exchange immediately. But none of the rate information or plan detail information will be available until September 1st.
Okay.
This is Leslie Johnstone. So does that mean we won't know carrier X submitted a silver plan and 3 bronze plans?
That is correct. We will not know, we will know the names of the carriers, but we will not know if they are in the individual market. We will not know if they've entered plans in the small group market. We will not know if they have entered plans in one of the 4 rating areas, or which rating area or service area they will cover. So we will have no information on plan availability and service area or rates until September 1st.
It's hot out there to be wearing a necktie.
And they just did
Mike, you have a question?
Yes, thank you, Madam Chair. Mike Wilden, ex officio. For the record, I'm glad John showed up because I didn't want to ask this until he arrived. But as a ex officio member who watched the legislative process, obviously, and participated frequently, so the 3 bills that got the no enactment thing, I would like to hear from John what he thinks are the message there was. The 3 bills got out of the Senate and Assembly. Commerce and Labor didn't want to deal with them, obviously. One of them I've heard, 2 or 3 times now today about, the regulation EX 01, whatever the regulation was. So I think I get the story there that they would prefer to have it done by regulation than by statute, but I'm kind of concerned or interested, I guess, on the discussion on 352 and on 454, because it sends a pretty strong message, at least in my mind.
For the record, John Hager, I'm not sure exactly what the message was. For 352 and 359, I'm not sure which one, but there was the only thing that I had heard from any of the legislators was that there were more pressing matters that they needed to attend to, and they simply didn't have time to deal with those items. For 454, and that was a different timeline because those 2 bills were not exempt. For Senate Bill 454, our exchange bill, there was concern about the exchange offering supplemental products when we haven't even started offering qualified health plans yet. There were concerns about setting a precedent with the premium tax, the exemption from the premium tax, and that could set a precedent. And those were the main reasons why Senate Bill 454 didn't go forward. Is that what you were asking, sir?
Appreciate that, John. I guess I'm just trying to figure out, again, I'm not a voting member, but going forward, I mean, there's some predicaments there in my mind. I mean, I know you and I have talked about, ways around and how you deal with it going forward, but
it just is kind of odd to me that quite frankly, disappointing from the legislature, and I'd say that even if they were here, that there are more pressing issues than what we're talking about here. So, I mean, they're dealing with board membership, board revenue, board the products, and so there's some pretty strong messages, at least in my opinion, from one side of the house. And so I don't know what that means going forward, in 2 more years when we go down the road, we'll obviously have more experience as a board and actually have a year or so's experience when we show up to the next legislature. So maybe it'd be a different story. But anyway, I just would appreciate, and do appreciate your comments, John.
And so welcome, John, to the meeting. You can get hammered with the first set of questions.
That's what I'm here for.
All right. Are there any other questions on the executive director's report?
You can leave now.
If not, then we'll go back to agenda item number 9. Yep. So on agenda 9, John and I discussed that there were a couple of things that we missed in the agreement, and we needed to bring it back to the board for a few amendments and make sure that the board agrees with those potential changes. So if we can turn to agenda item number 9. And then, John, if you want to start the discussion on this, that'd be great.
Sure. For the record, John Hager. So when we were going through the grant process, and we provided in February the proposal going forward, how we were going to provide the RFA, how we were going to make the selection, that we were going to ask members of the board to be on the selection committee, that the selection committee was going to choose the grantees, and then bring that back to the board as it's a final list. When we started going through the agreement, there is on page 2, section 6, there's talk about that process, about having board members be part of the creation of the RFA or RFP, being on the RFP or RFA selection committee, and then keeping the board informed about the contracts. But then when you go to page 3, sections 5, paragraphs 5 and 6, talk about selection of vendors, negotiation and execution, but it doesn't explicitly say grantees. Now, in staff's mind, when we wrote it sounded great, and vendors are contract vendors and grantees, but it really is not clear, and so we do think that we need to add that language if that is indeed what the board's intention was. And then the other part to that was that we wanted to be clear. It says in paragraph 6 on page 2, the request for participation of a board member, and as the RFA selection committee had 3 board members, we can't have any more than 3, but A isn't necessarily appropriate, so no more than 3 seems more appropriate. And then the last thing, we talked about this several times, and for some reason over the couple iterations it never got in there about the memorandums of understanding. So we added in there, bring to the board for approval all memorandums of understanding in my responsibilities, and then in the authority, negotiation of MOUs, but not the execution. That appeared to be the desire of the board, that the board would execute those MOUs. With that, I'll be happy to take any questions.
Do we have any questions from board members to John on the recommended amendments?
Madam Chair, just I guess questions on item 6D, again, ex officio non-voting member. At least from how HHS operates, memorandums of understanding are typically not contractual. I mean, I don't know how the AG's office looks at those. So we deal with those more agency to agency. So are those, I guess I'm just trying to look at, as one of your partners, HHS, we don't take memorandums of understanding to anybody above my level. So I would be signing a memorandum of understanding with the board, not with the executive director. Is that how that would work going forward? Or the questions too.
Well, I think this comes from a discussion months and months back where the board at that particular point in time was concerned that the MOUs were being developed without board input or review. I think it was mentioned at that point in time that typically these are agency to agency, but I believe that a majority of the board members felt that they wanted to have input into it since we were such a new organization. Now, maybe
Madam
on a
Chair,
go-forward
this is Lynn
basis, Ms. Atkins?
I'm sorry, I thought you were done. I apologize.
No, that's all right. Please go ahead.
Yes, I believe, and I think that was the concern, is that we wanted to see what the agreements were. All of this were new, and wanted to see what role both the exchange had, the Division of Insurance, and your division. But I think we're a little bit different, that we are a board and that we are working with John. I don't know if, I don't believe you have a board or the Division of Insurance has a board, but I might be really mistaken on that.
The HHS has 55 boards, so, but who's counting?
Well,
Depends
so
on
for
what the
purposes-
issue is. There are, I think, 55 boards.
Okay, so our,
If I might interject here, I think the differential or the differentiating point is the fact that John reports to this board and not to the governor's office, where in your situation, you're a cabinet member and report directly to the governor. And I think that was the one issue that made a difference in that discussion.
Well said, Madam Chair.
thank you.
That was much more artful than Ms. Atkins' previous motion from.
Having a rough time.
All right, so do we have any further questions or remarks or anything on the amendments to the agreement? And if there are
Madam Chair,
none,
this is Lynn Atkins. I would make a motion to accept the amendments as presented.
okay, is there a second?
Lavon Lewis, second the motion.
All right, any further discussion? All in favor of the motion?
Aye.
Any opposed? Motion carries. Thank you very much. That brings us to item number 10, which is the discussion and possible action regarding the review and/or ratification of the selection of the navigator and enrollment assister grantees. So, John, do you want to start the discussion on that, or is that going to be Shauna?
Just to start off, the agenda item is now posted. It's agenda item number 10. You can find it on our website now. I don't think we had any printed out down here, but it's all there. Shauna was instrumental, Mr. Roos was instrumental in putting this together, and so I'm going to let her lead off this discussion.
For the record, Shauna DeRoos. So it feels like we've been working on this a very, very long time. Back in February at the board meeting, we talked about a plan and how we were going to put an RFA out on the street, and it was going to be as detailed as possible, and it was going to require all sorts of information to be submitted. And we actually followed through with that plan. We put the RFA out on the street, and we had the mandatory orientation meetings that we talked about at that time, and we brought information back to the Grantee Selection Committee. The Grantee Selection Committee was Chair Campbell, Executive Director Hager, Leslie Johnstone, Ms. Johnstone, Mr. Tom McCoy, and Vice Chair Atkins. And they were given the information after staff made the initial review of the 41 applications that we received. We put together all sorts of information. We put together the coverage area. We put together the amount of the application. We put together the outcomes and measures and things like this that we thought were very, very important at that time. And we brought this to the selection committee. The selection committee really took a hard look at this and then had some very, very good questions and made it so that we could go back and actually further dive in. Some of the most important questions that they asked were things like, not only do we need to cover the whole state, but we need to cover the state in the most effective manner. Where are the people? How many people are there? Are you going to have the capacity to enroll these people? Are you going to have coverage enough in the South where the majority of the people were at? So it was very interesting for us, I think, as staff to go back and take a look at this more than almost from a statistical point of view, and to look at this and apply the math and look at how the information laid out that way. The second page of the report is a whole lot of numbers. I tried to put some colors here so that people could kind of see how I grouped the numbers. There's a Southern Nevada grouping, a Northern Nevada grouping, and a grouping that says rural counties not included in the above. It was very clear. We went and got the information from the census.gov website for 2011, and we looked up the number of uninsured people in each county. And then, of course, because it's for our target audience, we wanted to know the number of uninsured people above 138% FPL. When you applied then kind of our funding, how much money we had in this program, and we looked at where that money technically should go for where there's the most people. I think it's no surprise to anybody that with 73% of the people in Southern Nevada, 73% of the funding, then you point in that direction. I think it was very interesting to note also that in previous board reports, we had talked about the different methodologies of how people were going to access enrollment. We talked about the EEFs, the brokers, the call center, different things like that. And the EEF enrollment, we had formulated the calculations at that time that it would be about 44% of the population would use an EEF to enroll in the exchange. So if you take the number of uninsured individuals above 38% FPL and you apply the 44%, then you get the number of people that we expect these EEFs to actually enroll. We've said all along that our target enrollment at the exchange is 118,000 that first open enrollment, that first year. But it did not correlate out. We didn't specifically say we didn't expect the EEFs to enroll all 118,000. And that would be an overwhelming, daunting project for them. So this is definitely the capacity we looked at. We looked at the more realistic numbers. Can these people reach these estimates? So the way that then this kind of fell out, that we would need an average of 24 EEFs in the north and 67 in the south. On an average basis in order to make these enrollment numbers, these targeted enrollment numbers. The coverage map that is on page 3 of the report basically shows that there will be 5 counties that are very, very rural counties, and of which on the numbers page you can see 367 people is our target enrollment in those counties, and that we had limited applications, limited information to be able to cover those counties, and we are looking at additional avenues to reach those 367 people that are targeted there, and we will be working with broker community and things like that, and we will reach those. But the grantees that we are looking at here today are covered in the purple categories. All the other counties of Nevada will be covered through the selection. On May 28th, the Grantee Selection Committee met and approved the inclusion of the following organizations in the EEF project. So statewide, there were 3 agencies or organizations that will be working statewide. That is the Intertribal Council of Nevada, Know Your Care, and the Children's Cabinet. In Northern Nevada, there's an additional organization, Great Basin Primary Care. And then in Southern Nevada, Consumer Assistance and Resource Enterprise, or we call them CARE. East Valley Family Services, the Latin Chamber of Commerce Community Foundation, and Richard Allen Community Outreach, or RACO. In the coming months, we will continue to work with these partners. We're going to have meetings. We're going to have group meetings of all of the grantees together. We need to develop the plan, and these can't be little silos of plans. This needs to be a group plan. So even though these are individual grants, sub-grants, it will be a project that we will all work towards together. I'd like to just put on the record that in talking with these organizations, they have thought out of the box. They have been very, very flexible. When we talked about the fact that the funding was being reduced to cover the first open enrollment, that they all jumped on board and accepted this and really worked with us to get their budgets down to that level. And it was very enjoyable to work with these organizations. So with that, I can answer any questions.
I think, Mr. Roos, I think, unless I missed it, didn't you want to put on the record also that the funding is just out through March 31st?
Yes, I believe. I'm sorry. Did I not just mention that?
Maybe you said it and I just didn't hear it.
The current subgrants will cover the period through the first open enrollment of March 31st, 2014. So early on in the spring, January, February, not only will we daily be looking at enrollment numbers, because through the web portal, we will get to see, everyone will have their number and they will come through, and then as they enroll people, we will be able to see those people that get enrolled, and we will see which organizations are really producing. Early on in the process, January, February, we will be looking at how we will continue this process, who will continue on throughout the summer months, who will go into that second open enrollment, and we will continue this process out. But it's a big project. We want to make it work. We want to have that opportunity to have lessons learned so that as we go forward with it, we can kind of use some of those and not make the mistakes forever. And so that's why it was kind of cut down.
Mr. Hager, is there anything that you want to add to this report?
No, ma'am.
Okay. And then, all right.
This is Dr. Ford. I have a question.
Yeah, I'm opening up for questions now. Ms. Johnstone?
Thank you. Misters, can you explain what the current plan and schedule is for the DOI certification for these groups?
On a very broad basis, yes, I can. When AB 425 was passed, it gave the DOI the ability to certify the EEFs in Nevada. What this means is that EEFs will need to take a class. It's a 20-hour course approximately. They will need to take a test to pass that course. Then they will need to take a state test. They will also need to be fingerprinted and pass an FBI background check and apply to the Division of Insurance to become an EEF, an exchange enrollment facilitator. They are working with us to create the test, create the class, the curriculum, and we are going forward with that. Damon Haycock, our research officer, has been instrumental in making that happen. Then additionally, once a person has that certification in hand, they will come to the exchange. They will then go through about a 4-hour class with the exchange, and that will walk them through the web portal, the tools to help them work with the staff, work with the people that they're going to sit down with and help them enroll. They may start an enrollment with somebody and need to come back later, and part of their dashboard will say, these are the people you need to go check out. So there's different tools for them. So once they go through the DOI process, then they come through our process. But I also then don't want to say that we will just send them out into the world and never see them again. We will have continual processing, continual oversight. We will work with them. We plan on traveling, going to some of their events, watching them, helping them, refining the message that they are putting on the street so that we make this successful.
Madam Chair, can I add to that?
Certainly, go ahead.
So the time frame for that, the 20-hour training course, we're expecting that to be up and running sometime in the first half of July, hopefully, to mid-July. The training or the test is expected to be available mid-August. So we should be able to get everybody tested between basically August 15th and September 30th. We expect that the background check process will begin as soon as the navigator enrollment assister entities identify who their people are, so they can get the background checks going. I think once the course test and background check is done, I'm pretty sure that the certification process with the DOI is fairly quick. And the 4-hour training that we have following completion of the test, that would also be available sometime late August to early September. We don't anticipate any problems getting everybody through those courses and under our current training. We're obviously refining this as we get further into the process. It's an iterative process creating this plan.
Thank you, John. This is Leslie Johnstone. Just one quick follow-up. How much of their training, if any, is dependent on knowing the plans that are going to be on the exchange? I mean, we know today that we're not going to know any of the specifics until September 1st. Is that maybe going to create a bottleneck?
For the record, John Hager, we don't think so. The way that the producer course is set up, it's a general course on the basically the rules of the road in health insurance. So the course for the navigators will be very similar to that. The rules of the road for health insurance, but focused on the Affordable Care Act and the new rules that'll be effective January 1st of 2014. So it'll have a combination of state law and federal law that the individuals will be tested on. It's not program specific. The 4-hour course that we provide will have slightly more specifics about it. The rates are not going to be available till September 1st. We may potentially be able to portions of the plans prior to that. So we're not sure about the timeline yet. We're trying to figure that out. But it's the rates specifically that are not supposed to be released until September 1st. We may, like I said, be able to see the carriers and some of the plans that in a broader scope prior to that. But again, we're still working on that with the DOI and making sure. We want to make sure that anything that we release to the public does not give anybody else an unfair advantage. And so we have to be considerate of the fact that we've got plans inside the exchange. There are carriers outside the exchange that aren't participating, and we don't want to give them an unfair advantage over the plans that are offered inside the exchange. So that's why the delay in the rates anyways. But again, we might be able to have a glimpse of the plans earlier than that. Again, I don't think that it's necessary. Our focus on these training items are to help individuals know where to look for the information. Keep in mind that the plans are going to change year over year. This initial training, while there will be required training as we go every 3 years and some continuing education along the way, this training is not meant to provide specifics of the plans themselves, but more along the lines of broad information, where you can go to get that information, a review of a tour of the web portal. You know, if you want to find out information about this plan or that plan, this is where you go to get it. This is where you get the specific information.
Do we have any other questions for Mr. Hager?
This is Lauren Lewis, and I'm just wondering, do we have the dollar amounts of the awards that we are going to be granting here?
For the record, Shauna DeRoos, the dollar amounts were not included in the report as the budget negotiations are ongoing. So those are not available at this time.
Right, and John, help me walk through this. Because we approved in the prior agenda item that you had the authority to do these grants, then really this isn't a possible action item for us. It's just a review of what's being approved by you. And
for the record, John Hager, our intent was that this was provided to the board as a review. There were concerns with previous RFPs about ratification versus not ratifying items, and it was my fault for not including board members on those review processes. And based on the previous item, and I think based on the board's the reports that we provided for the board in the past several months, and the fact that we had board members on the selection committee, I don't think that this needs to be ratified. But of course, it's up to the board's or the chair's discretion.
Is there? I think that from what I understand and from what our original motion was back in, was it February when we created this board, that it would be brought back to the board after it had been approved by you and reviewed by the subcommittee.
That is our understanding, yes.
Okay. All right. I would make one request. When you do get done with your negotiations and everything. Would you please submit a report to the board? Because I believe Ms. Lewis is correct. Everybody would like to see how those negotiations finalize out.
Absolutely, I can do that. And I don't know that it'll be a separate agenda item, but I'm sure that John will include this, Mr. Hager will include this in his executive director report going forward.
Okay. All right, and if there are no objections, let us move on to agenda item number 12. And congratulations to all the awardees.
The agenda item number 12 is the star rating system.
We can't hear you. Can you press the mic button and start again?
For the record, Damon Haycock, Finance and Research Officer for the Exchange. I do not know how to work microphones. My report, item number 12, is on the star rating system for accreditation. I do want to ensure at the beginning of this report that we do not confuse the accreditation star rating system with the consumer survey star rating system. The BOSS is being designed to showcase both of those rating systems, and this report is specifically on the accreditation part because the consumer survey has not been completely developed by the feds, and that we have not obviously sent them out to the consumers because we have not implemented the exchange yet. And so that process will be forthcoming and included on the shop and compare screens as that information becomes available. So the federal the federal regulations require that all exchanges maintain an up-to-date internet website that provides standardized comparative information on each available qualified health plan, including at a minimum the results of enrollee satisfaction surveys as well as other rating factors. So in today's marketplace, the National Committee for Quality Assurance, otherwise known as NCQA, and URAC both provide accreditation for the healthcare industry, as well as those quality measures and reporting. So specifically, NCQA utilizes something called HEDIS, the Healthcare Effectiveness Data and Information Set. It's a tool that measures performance on important dimensions of care and service. There's 75 measures across 8 different domains of care. Additionally, the Agency for Healthcare Research and Quality within the U.S. Department of Health and Human Services developed a program called the Consumer Assessment of Healthcare Providers and Systems, known as CAPS, and to support and promote the assessment of those consumers' experiences with healthcare. So this program was developed to help standardize patient surveys to compare results across sponsors and over time, as well as tools and resources that the plan sponsors can use to produce understandable and usable comparative information. So utilizing these tools, NCQA developed what they call a health plan report card. It assesses a health plan utilizing, of course, a star system. It's a 1 through 4 stars, and I've included in Table 1 a portion of that current report card of a accredited plan in Nevada. And so, as you can see, that it includes both the HEDIS measures and the CAPS measures. Of course, the accreditation status is accredited, or you wouldn't see this, and it goes over 5 specific areas: access and service, qualified providers, staying healthy, getting better, and living with illness. And so basically, when these report cards are developed, these performance results are rolled up into one overarching 4-star system, and that can be displayed again on our BOSS. Now, the web portal, of course, is being designed to display this, and we anticipate some form of a similar report card system. We haven't worked out those details as of yet. Now, in May 2012, the Center for Consumer Information and Insurance Oversight, or CIO, released guidance for quality reporting and display requirements for all exchanges. That guidance pushed reporting requirements and quality ratings out to 2016. And it was intended that the feds wanted actual data, and since exchanges are new to this environment, entering in that quality data at the onset may not provide the most accurate information on those plans, so they kicked that out to 2016. So in the interim, though, they did notice that the federally facilitated marketplace will display existing consumer assessments and healthcare providers and systems, or that CAPS data, from accredited commercial and or Medicaid product lines where those are where they actually have existing data today. And so they also require it to tie likes to likes, HMO adult CAPS results for HMO QHPs and child CAPS results for child only QHPs. So with this guidance, the FFEs, or the federally facilitated marketplaces, will be utilizing the existing CAHPS data, and Society will allow all the exchanges to display quality ratings on existing plans during this open enrollment here in October. There are benefits and there are some drawbacks to displaying this information at the onset of the exchange implementation for plan year 2014. To date, the exchange staff has solicited recommendations from both NCQA and URAC, and interestingly enough, or ironically enough, that they have vastly differing opinions on it. So some of the benefits first of displaying quality ratings in 2014, NCQA indicates that there's, of course, a multitude of these benefits. They believe that how the plans have performed to date is very relevant in the selection process for an individual who wants to purchase a qualified health plan. There are a number of states that are already going to be participating on this quality rating process, Oregon, New York, and Minnesota. Of course, any plan that is brand new, that has not been accredited before or has not done quality reporting, does not have a track record to share. This goes back to the public comment earlier today about the co-op, who is a newly organized entity, and they will not have that information at the beginning of open enrollment. But NCQA feels that to exclude rating information from the decision process actually takes the opportunity away from consumers. And so the exchange, of course, has consistently ensured that all information is completely transparent to the public, the board, the state, and the federal government. Providing rating and accreditation information on the web portal is consistent with this exchange ideal. However, there are some drawbacks. So on the other hand, URAC believes that displaying rating information on plans that now must exist in this new environment is unfair and inappropriate. First of all, just as the co-op had mentioned in public comment earlier, that these display ratings are only being displayed on plans that existed before the exchange, before the ACA rules go into effect in 2014. They do not necessarily reflect or predict how these plans are going to actually perform in the exchange marketplace. Furthermore, of course, there are those that are going to receive a not as yet rated. Again, I will utilize the co-op as an example. And so with that not as yet rated, that issue may drive individuals and families to purchase higher rated plans that existed prior to the exchange. Now, there's some ups and downs with that as well. Of course, those plans may receive higher enrollment than equal plans without ratings, which of course creates a competitive disadvantage for those carriers that do not have those ratings. But they also have some potential adverse selection. If everybody rushes over to a high rating plan, they'll have over enrollment, and then they'll have all of those claims that they're going to have to pay for those folks, causing an imbalance in the marketplace as well. And so there's some definite differences, and URAC has a paper that they summarize these issues. That's in attachment A, rating health plans on exchanges. I won't go over that because we basically summarized it here in this report. And as far as the exchange's ideals, has consistently supported its free market facilitator approach, so encouraging healthy competition while protecting consumers. By showcasing ratings on plans that have never been utilized in the new exchange market and potentially driving people away from unrated plans may undermine healthy competition and that sustainable market. So our recommendation to the board today is to determine what accreditation status should begin to be displayed on the Nevada HealthLink web portal. And before I turn it over to questions, we will, of course, move towards accreditation star system in 2016. That is hands down, it's going to happen. The decision we believe today is, do you want to start it here in 2014?
All right, I will open it up for questions. Any in Las Vegas?
It's Ron Klein. Just can you give us the 30-second version of the consumer star system, since there are two different ones, and when that starts and how that works, since that might be relevant to this other discussion?
So for the record, Damon Haycock, to answer that question, I have not seen, and no one has seen the federal survey yet to determine how they're going to aggregate those pieces of information. But I'm going to go out on a limb here and throw out an assumption that they're going to have specific metrics that are going to be tabulated, and those tabulated metrics will roll into a star system. And so when an individual wants to purchase a qualified health plan, they will see that their accreditation, their NCQA or URAC accreditation, is going to have, say, a 3 stars. But the consumer survey says they have 4 stars. And I don't know if we're going to be able to utilize some form of response or commentary like you see on when you buy a book at Amazon.com, how many people have actually liked it and wanted to report on it. But all of that is still yet to be determined.
So just to be clear, that so we're not anywhere close to this consumer star system yet. We're more than a year away, or we think, or?
For the record, Damon Haycock, the consumer surveys will be released by Socio when they release them. I wish I could give you a better date, but those will be. I'm going to again assume that they're going to be out for January coverage launch, and therefore at the end of every quarter, those will be tabulated, and then I would again assume, I hate to go out on a limb, that we'll be able to start displaying that information mid-year, but definitely for 2015.
Right. Do we have any other questions? I would ask the question. We are prepared to use the STAR system and certification system right now. The question is, do we want to give enough time for these unrated systems to start getting some STAR points on their reporting?
For the record, Damon Haycock, I think there's three things that you're going to want to consider. Yes, that is one of them for those non-rated plans. And yes, we are prepared today. It is built into the BOSS. I've seen some other screenshots of shop and compare screens that already show the STAR rating system in there. So it will be available on launch day. So that answers the second one. But there's also rating for plans and carriers right now that is based off of market rules today. And so how those plans perform today is not necessarily how those plans are going to perform in the future. They may perform better, they may perform the same, they may perform worse. And so a consumer is going to be making a selection based on the track record of that plan that is already accredited on old accreditation rule sets. And so that's something that I believe that the board will want to take into consideration when they decide. The true issue is, when do you want to have that display?
Ron Klein, I know we don't know who is going to be on the exchange at this point, but other than the co-op that we heard about before, are we aware of any other organization that would not have a previous HEDIS CAPS history?
For the record, Damon Haycock, I have yet to get the, as you said, total names of all the carriers that are participating on the exchange, but my knowledge is that no, only the co-op is a new entity that has not been previously accredited, but there are potential discussions of a multitude of carriers that I didn't even know that were going to be on the exchange. So I couldn't give you a 100% accurate answer.
But the carriers would have been pre-existing before. They would be already existing insurance companies with HEDIS CAPS scores, correct?
Correct. And those scores will be tied directly to their health plans. So different plans will have different scores within the same carrier group.
So with no disrespect intended, we're really talking about one co-op here that wouldn't be ranked while everybody with previous data, while everybody else would, if I understand correctly.
That is one of the issues on the table today, sir. Yes.
For the record, John Hager. So yes, there should be HEDIS and CAPS data. The STAR rating system is based off of accreditation, and so while all of the entities, I think, would have HEDIS or CAPS data, or potentially have HEDIS or CAPS data, the ones that are in existence, they may not be accredited. They may not have had an accrediting organization and take those scores and put them together. They're all in the process of doing that if they're not already. One of the interesting things, UREC and NCQA report on different things, so we'd have to look at that, and we can figure that out. That's not the issue here. So there's a couple of different solutions. Number one is to delay reporting of the STAR system. Number two is to show no stars, like the empty stars, but have an ability to click there and say, basically this discussion that we had today, we are getting into this process, and if you'd like to know more about the STAR rating for your organization, click here. That might be a way to do it, rather than having it bold in your face. The other potential way to do it is to look at, for those that are in the process of becoming accredited, utilize some form of STAR system that measures what they've done so far. Or again, the other option is to simply not show it for the first year. Maybe we wait till the second open enrollment. Obviously, pros and cons. If you don't show it, you are losing out on, the consumer is losing out on additional information that they could use to select that plan. So how you make that even or fair is a big question that we'll have to figure out if we decide to go forward with it.
Madam Chair, this is
Lynn.
Leslie Johnstone.
Go ahead, Ms. Johnson.
I think that we don't know what these plan designs are going to be. We don't know what the networks are going to be that will be put into these plans. We don't know how different or how creative some of these carriers may or may not get. And so I would be not in favor of including the star rating as if that's the star rating for the plan that is on the exchange, because that may or may not be comparable. At most, I would think giving the consumer a link to the carrier's star rating someplace else so that they can see, what the carrier tends to receive on their star ratings, but make it very clear in the display that those rates are not directly related to what plan is on the exchange. I just think it's apples and oranges.
Do we have any other
This is Ron
comments?
Klein. Yeah. Does anybody else want? Okay. This is Ron Klein. I would respectfully disagree. I think sometimes perfect is the enemy of good, and the system is not perfect. But I think the only way we get carriers to behave better is to let people know how they're doing in terms of the HEDIS system, in terms of the consumer system. The system works fairly well on eBay. I mean, I think people who don't treat their customers, sorry to, make this lowbrow, but those who don't treat their customers well, go out of business because you look at there and it says that, they have a lot of complaints. So I would be in favor of having a star system now, and make it as fair as possible. So to John's point, people who are going through the HEDIS certification right now, I think we should use everything to include them. I think for the co-op plan, I think we should be as fair as possible and put something there where the stars would be that says this is a new organization and HEDIS stars are not available at this time. I mean, nothing negative, just purely a neutral statement. But I think the benefit of giving consumers the ability to see how well a plan behaved outweighs the negatives. And I disagree with the statement that it's a new environment and a new system. The insurance companies are the insurance companies, and those that have behaved badly in the past will likely behave badly in the future. And those that have behaved well in the past will probably likely behave well in the future. So I don't think that something suddenly changes. And I think, again, I'm completely fine with full informed consent. I think if we want to put on there that, this system, these marks represent, evaluations from 2012 to 2013 or whatever, and may not reflect current practices, I'm completely fine with that, as long as I think we give people some idea of how their plan has performed, because that's the only way the system gets better. Because if a company behaves poorly and they get few stars and they lose customers, then they have an incentive to get better. And if we don't put those stars there, they have no incentive to get better.
Marie Kerr, I actually disagree. While I am completely in favor of transparency with the consumers, there is information out there about different insurance plans, not just from our website. And the potential for adverse selection and turning consumers away from what could be very good plans that just haven't been, it is a new market. We are dealing with a different type of, with different types of entities. I think that we don't want to turn people away. When I'm looking on eBay and I see something hasn't been rated yet, I'm automatically going, well, I don't want to buy that. And that may be too simplistic, but mind you, again, as I said earlier, we're dealing with people who have limited time and are, picking plans and who are not experienced with picking plans on the internet. And I think that we should defer it for a year and then institute the star rating.
This is Lynn. If I might just comment on that. I also think, though, that, yes, people have limited time, and we're talking about a group of people that are inexperienced with health insurance, and I think we need to provide as much information as we can that is easily accessible to them. I think if we're going to hope that they do some outside research and start looking at other websites, I worry about that. And I think I agree with Dr. Klein. I think if we can post what we have and what we know, and for an organization such as the Co-op that isn't yet rated, be able to say that as neutrally as possible, that it's not a negative. I think it's a place to start, and I would not support deferring it for a year.
I agree. I think that the people who will be enrolling in our plans need as much help as they can get in making appropriate selections.
I'd like to ask a question of staff. Maybe you know Mr. Haycock, but when these rating systems are correct, are posted by URAC or the other certifying agencies, is there an appeal process for those insurance companies to go back to them to say that the rating's incorrect?
For the record, Damon Haycock, I have not seen any appeal process, but that doesn't mean that it doesn't exist. I was able to collect this report card directly from the NCQA site. I did not see any link that said if you're a carrier and disagree with this data, please contact NCQA. But that doesn't mean that there isn't some backdoor process for them to disagree with the rating system from the data that is collected. It is my understanding that all the data is standard, and so it's on standardized surveys, especially the CAHPS data. And so the data is what the data is, and I don't know if it is appealable. So that's probably the long-winded way of saying I don't know.
How do they collect the data? Is it coming from customers, clients, patients, or is it benchmarks?
The actual CAHPS data is consumer surveys that are sent out to consumers. I believe it's randomly and periodically, and those consumers will then respond back on their experiences with their health plan or with their provider or with their network, and then they will be collected and aggregated and then turned into an actual star rating.
Okay, and then if it's anything like I think it is for the hospitals, I think their response rate is somewhere, I mean, it is very, very low.
For the record, John Hager.
Correct or not?
This is Leslie Johnstone. I can clarify on the hospital. They have to keep going on the survey until they get a credible response, number of responses.
So, Ron, can I just add just a little in terms of real world life experience? Medicare starts counting various different complications and things for various procedures in hospitals, and they post those on a website. Most people probably here are familiar with that. I will tell you, and I will tell you that when you go in the doctor's lounge, there are memos from hospital administration that say, fix this, do this, don't let this happen, be aware of this, all in response to the fact that people are now being measured against those criteria. So that's an example. When you measure something, organizations that are being measured respond and try to improve. So that just sort of speaks to what I said before.
Mr. Mullenkamp?
Yeah, thank you. I just, it sounds to me like through the discussion that we are talking about doing a rating on something that we really don't have any experience with, that we have new plans that are not, there's no experience with which to rate the plans. And I guess my question would be, do we submit ourselves to any kind of legal or financial exposure if we are trying to say that this is the rating of a plan when there's no experience with which to make that judgment? I know we could put caveat language or disclaimers or things of that nature that maybe would protect us, but just from my vantage point, I would be concerned about trying to apply a rating to a company when the plan itself may have a whole lot of different components than what they have out there. And I'm not sure if I'm fully following the discussion, but I would have some concern that we at least want to make sure that there's no legal exposure we're creating.
For the record, Damon, Haycock. Come on, Mike. Just to address Director Mullenkamp, I believe that the exchange would not be administering its own rating system. It will not be determining a rating factor on a plan. From a legal perspective, the rating system is developed from the accrediting entity and through the plan certification process for all qualified health plans on the exchange, both on the shop and the individual market. They're required to, if they're not already accredited, to go down the path of accreditation. And so therefore, it would be directly tied to the accrediting entity's score, and that the liability for that score would rest with NCQA and URAC.
One last,
Dr. Klein,
maybe last question. The rating system is for the entity, not for each one of the plans owned by the entity. Is that correct?
That is not correct. The rating system is for the specific health plan. And so there will be an HMO rating system or there'll be a rating system or a report card for a specific HMO plan that the carrier offers in a service area, for a PPO plan if they offer additional plans. It is not one carrier rating, but it is the plan itself that is being rated upon, because not all plans are built equally by the same carrier.
For the record, John Hager. And what Mr. Haycock said is absolutely correct. In 2014, the NCQA and URAC, I believe, are rating based on the plan. The current system is rated based on the product. So if United Healthcare, say, had a PPO product and an HMO product with multiple plans in each product, each of the plans in that product would have the same star rating, and each of the HMO plans in the HMO would have the same star rating.
Dr. Klein, I'd like to make a motion if it's appropriate. Madam Chair? Okay.
Yes.
Okay. So I would move that the exchange incorporate the STAR system into the web portal as discussed, and that we use all our efforts to not disadvantage plans that have previously that do not have HEDIS or CAPS ratings by virtue of there being new plans, and that we put all the appropriate information on the website in terms of the data limitations and the time periods that are being incorporated.
All right. Is there a second to that motion?
I second the motion.
All right. Open it for discussion again before I call for the vote. All right, I'll call for the vote then. All those in favor?
Aye.
Any opposed?
No. Opposed.
And chair's opposed. So, but the ayes have it. So we'll move ahead with 2014. Moving on to the next agenda item, number 13. It's the review, the purpose, state, and consumer selection of the Medicaid Managed Care Organization transition. Who is doing this one?
I'll take care of that one, Madam Chair. And
Okay.
For the record, Ms. Lewis is leaving us.
Sorry.
So for the record, John Hager, item number 13 is about the Medicaid Managed Care Organization transition plans. So Medicaid, through its RFP process to request proposals for managed care organizations, included in their RFP a requirement that the winning vendors included a silver level plan in the exchange, designated as an MCO transition plan. The idea of the transition plan was to help with the issue of churn. So as we've discussed before, there are two parts to churn. There is the magnitude of churn, the number of people that turn over from Medicaid to off Medicaid, and between various products for that matter. And then there's also how you help those people who are churning to not experience disruptive care. So the idea of the MCO transition plan in the contract, they were required to this transition plan was required to go by the requirements of the Affordable Care Act and be licensed by the Division of Insurance. They were to use a similar provider network using best efforts as available for to those eligible for Medicaid, be available to consumers in the same geographic area as the geographic area served by the vendor's MCO, coordinate prior authorizations and edit patterns for members who transition between the vendor's MCO and the vendor's QHP, and the vendor's not required to consider out-of-network providers as in-network providers. and then use a formulary that is similar. The RFP contract was approved by the Board of Examiners on May 14th. It includes vendors. The MCO plans are offered in Washoe County and Clark County. So then if you have an MCO transition plan, those would be required to be offered in those service areas. So service area 1 is Clark and Nye, and service area 2 is Washoe County. So those two service areas, so the carrier would be required to offer that MCO transition plan in those two service areas. And if you recall, the board meeting or the one before that, we discussed excluding that one additional plan from the maximum of 5 plans per service area, per licensed carrier, per metal tier. And it's only one for the one silver individual plan that's available to be extra. Now, originally we had considered whether or not we can limit enrollment to those plans to just those who have come off of Medicaid. And based on review of the law and the bridge plan requirements and how that one worked, we couldn't limit enrollment due to the guaranteed availability rules. We have to allow anybody to enroll on those plans to enroll in a qualified health plan. So instead, what we're doing is we are, if you come off of a Medicaid MCO, that transition plan, that the sister company or the parent company would offer the Medicaid, the MCO transition plan, and it would be filtered to the top of the list for that person that came off of Medicaid. Now, if you're not coming off of Medicaid, it would be available anywhere, but it would be in the normal sort pattern, so there's nothing to put it to the top of the list. And there would be some functionality that will say, all right, this Medicaid transition plan, this is why it's important to you. And mostly it's surrounding individuals with chronic conditions. Are my drugs covered under the same, they're covered, or episodes of care. What happens is when a person if a person comes off of the Medicaid MCO and onto the MCO transition plan, if they select that plan, and then if they select the waiver, the information release that says that the Medicaid organization can transfer that information to the QHP through that firewall, then at that point we would send a flag to the carrier stating that this is a valid MCO transition person whose care should be managed. Not that they shouldn't be managed with other plans, but that they can actually pull information from the Medicaid organization to the commercial product. That's what's really important, is being able to pull the information from the MCO to the commercial product to be able to follow up on the things that are already in the system, the edits, the pre-authorizations, and stuff like that. And it would require then less information from the individual. So if an individual is in an episode of care and they go to a new insurance organization because they're no longer eligible for Medicaid, that information will be transferred automatically to the new organization rather than them having to contact the organization, go through pre-authorizations. The providers theoretically would not have to go back and request that information again. We'll see how well that works. We're very hopeful that will work well. The next steps for this, besides communicating all of this to the IT vendor who is aware of these requirements, well, it's not a next step. They're already aware of it, but to monitor the enrollment patterns and the use of those services to make sure that they're being utilized properly, that the commercial products are doing what they're supposed to do in these circumstances, and then we need to consider whether or not that these items should be expanded in future years, whether or not we could allow Medicaid transition plans from other carriers potentially, or whether we expand that requirement to products in general. So it could be, we just say in the future, just Medicaid transition plans, and it's a way for you to market your plan as we are communicating with the MCO or Medicaid, or simply we at some point perhaps would require it of all plans. We need to have this as kind of a pilot as it is right now to determine whether or not, to determine how much we use this and how this goes forward. And then the other thing that we're looking at is the bridge plans. I believe both California and it might be Washington are going forward with bridge plans. I'm not sure exactly. We're going to monitor those states and determine how those bridge plans work to see if we can use what they're doing or what they learn in this concept or not use this concept and go to the bridge plan. Just something to keep in mind for the future. So we're going to monitor all this stuff and come back probably as we go into the 2015 plan year to say this is working or it isn't working. This is how we're going to go forward with this in the future. But this is basically the first step for 2014.
All right, John. So this is our review then. We asked you to bring it back and explain it to us a little bit better. So anybody have any questions of John on this? There being none, then the next item on the agenda then is the possible action and dates of other agenda items or future meetings. When is our July meeting is scheduled for?
The second Thursday of the month, which is the 11th, July 11th.
Okay, July 11th. Yeah. Okay, does anyone have any suggestions on other agenda items that they'd like to have brought forward in July? Lynn, do you want to bring back that clarification of that motion at the July meeting?
Sure. If it's okay, if I can speak with Mr. Hager offline and
just
determine if we actually need that done or not.
Okay, that may be something that we can just do internally that clarifies it in your mind.
Thank you.
Any other suggestions or recommendations?
In July, we have our typical quarterly reports that we'll provide. We were originally going, and I think you probably already covered this, we were going to have the adoption hearing for the regulation you heard today, but that will be pushed to August. It's not a rush, but I do think it's important to get that done eventually. So we'll give ourselves plenty of time to consider that. Depending on a few things, we might have an additional regulation workshop for July. There's some language in AB 425 that we have to work through and determine if we need regulation for that. Otherwise, we will let the board and the chair know what additions we have.
Okay, let me just ask a question of board members because July and August tends to be heavy travel days for families. And I realize Ms. Lewis has left, but the other three of you available for the July 11th meeting?
Yes.
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 Okay. And how about up here? I know Ms. Johnstone you won't be, but everybody else is. So we won't have a quorum problem then. Thank you. That brings us to public comment again. Do we have any public comment here in Carson City? How about there in Las Vegas?
Yes, we do.
Good afternoon. For the record, my name is Rene Cantu. I am the Executive Director for the Latin Chamber of Commerce Community Foundation. I wanted to express my gratitude to the staff and the board for this partnership in which we're now entering for navigators and enrollers. We're excited about educating the community, having people, helping people have access to affordable health care, and look forward to a good process. I also wanted to thank Rosemary Flores, who helped us become aware of the RFP and to make the meeting on time. And last but not least, I do want to express our gratitude on behalf of our co-presidents, Irene Bustamante Adams and Eloisa Martinez. So thank you all so much.
Thank you. Do we have any other comment in Carson City? How about on the telephone? All right, doesn't sound like we have any. I want to thank everyone and particularly staff for putting everything together for us in such an organized manner and give us lots of good reading material at night. And we'll look forward to seeing everyone July 11th. Thank you.